Quite simply, we're needed. Worldwide, over 300 million women suffer from complications in childbirth. And of these, 1 in 20 experience a serious morbidity. The obstetric fistula is among the worst and most devastating. The Worldwide Fistula Fund exists to provide prevention, surgical intervention in the form of a cure, rehabilitation with physical therapy, and social reintegration. Ultimately, we're seeking to prevent obstetric fistulas from occurring in the first place. And we're doing this with prevention programs working collaboratively with government agencies and other organizations on the ground. But we're also intervening to eliminate the fistulas that are out there today and reintroduce women to their villages and give them back their lives and their dignity. We're rehabilitating them following surgery with physical therapy, and we're performing those protocols using evidence-based medicine. We're collecting data, so we're actually conducting research as we go along to constantly improve upon the methodology and the science of fistula repair and intervention. So our goals and our mission are quite comprehensive, and we are not doing this alone. We're working with dedicated individuals who have a passion for restoring the lives and dignity of these women who are so devastated. We're working with other teams and other organizations throughout Africa and other undeveloped and developing nations across the globe. We've already implemented the first of these leverage points. We've consolidated our management and administrative functions under a single entity, W.J. Weiser and Associates out of Chicago, and they really helped to streamline our access to IT services, auditing, banking, global travel expertise, and other such administrative functions, and saving our overhead expenses along the way. The other key leverage point is collaboration, quite honestly. And in Niger, for example, we have successfully collaborated with SIM on the ground to give us access to their infrastructure and knowledge of the local culture of Niger. We have models underway with Terawodi in Uganda and also the Fistula organization in Ethiopia. And we're bringing this leverage to increase our outreach and therefore our impact globally. Without a doubt, it's the people. It's the people who are dedicated to the mission, who have a passion for rescuing these women and restoring their lives, who know how to work together with others and apply their skill sets and their depth of knowledge about the condition. We also work with partners on the ground, and that makes a tremendous difference. Partners who know the local language and the culture and who have an infrastructure so that we don't have to duplicate those things. It makes a big difference. We measure success essentially in 4 different ways. First of all, successful surgical outcome. That means that a woman is dry or certainly able to manage her leakage with pelvic floor muscle exercises following surgery. The second metric is research studies so that we can push the science of fistula repair and intervention in a variety of ways and share that knowledge with others around the globe. A third way that we measure success is through the collection of data so that we can conduct research studies and so that we can evolve the science with evidence-based medicine. And fourth, the demonstration that it's really a team that makes a difference, a team of experts that work in collaboration with each other. The Worldwide Fistula Fund has a very comprehensive mission. Unlike a government agency or even other NGOs that are focused on fistulas, we cover prevention, surgical intervention and treatment, rehabilitation postoperatively, and also social reintegration. So we're quite comprehensive. Another thing that sets us apart and that probably is not very well known is that we have a small board of directors. We're all volunteer. We have our own careers and other lives, but we do have a tremendous amount of experience in global health initiatives, in healthcare in general, in marketing and management, and we bring those skill sets to the table. We're not involved with this organization to further our own egos or commercial interests. We're here because we have a passion for the mission of the Worldwide Fistula Fund, and we're dedicated to achieving that mission. Well, a major accomplishment was opening the Danja Fistula Center in one of the world's poorest nations, Niger. It's a specialty surgery center, and it provides not only a cure through surgery for these women, but there's also temporary housing for them before and after surgery. That's where we provide the rehab with the help of physical and occupational therapists, and it's also where we provide job skills training for social reintegration. Another major accomplishment is the training of a surgeon in Tanzania, and we have since placed him in northern Uganda where he was needed. We have undertaken the support of an OBGYN residency program in Ethiopia, and that includes training in fistula repair for the doctors there. We have support for a doctoral student in anthropology to study the causes of this problem and the social milieu in which it occurs culturally. And lastly, we're supporting a council of occupational therapists and physical therapists to develop protocols for rehab. Certainly, gaining the attention of the public to the plight of these women has historically been a major challenge until recently when Nicholas Kristof of the New York Times and several other journalists began writing about the fistula problem. Certainly, governmental apathy and political stability in this region of the world continue to be an obstacle for us and many other organizations trying to operate in this area. It's difficult to operate a medical facility in a nation with very poor or weak infrastructure, particularly in the face of security concerns. Numerous realms need additional resources at the Worldwide Fistula Fund. Transportation of patients has always been a significant issue and oftentimes a much neglected one. We envision having a fistula bus that would run a regular route through the countryside and give women access to the center. We need marketing with radio broadcasts so that we can alert people to the fact that the Fistula Surgery Center is open and operating. Internally, We need to take capacity building measures. We need a strategic plan. We need a fund development plan with tactics for generating the funds to expand our model into Uganda, Ethiopia, and other nations in this developing realm. On the medical education front, we need more doctors, particularly more OBGYNs, specially trained in fistula repair. On the public education front and in preventive health services, we need more supplemental experts. We need more nurse midwives, particularly aimed at reducing underage pregnancies. And lastly, to help these women following surgical repair, we need an infusion of microfinancing to really boost their ability to contribute to their local villages and be fully integrated. This will elevate the status of women. Big gaps mean big opportunities for change.